Hello, my name is J.B. Boone, and I'm a rheumatologist at Rheumatology Associates in Louisville, Kentucky. And today I want to speak with you briefly about gout. Gout is a common condition that we see here at Rheumatology Associates, and it can be a big problem for our patients. Gout flare attacks can be incredibly painful and can deprive patients of both their functionality and quality of life. Thankfully, here at Rheumatology Associates, we are quite adept at managing gout and getting patients back to a state in which they're enjoying life without experiencing gout flare attacks. Today I want to speak briefly with you about what causes gout and how we manage it. So gout is caused by a substance in the body known as uric acid. We all have uric acid in our body, and it is a normal byproduct of our cell's metabolism. Every day our cells are producing uric acid. And under normal circumstances, the uric acid remains fully dissolved in the bloodstream and does not cause any problems. In patients who have gout, however, the excessive uric acid that is being produced cannot stay fully dissolved in the bloodstream. And that uric acid in a gout patient will actually transition from a liquid to a solid form, leaving the bloodstream and entering joint spaces, which is what causes a gout flare episode. Gout attacks or gout flares are characterized by usually sudden onset of intense pain, often accompanied by tenderness to touch, swelling, warmth, and redness at a single or sometimes even multiple joints. Now, our bodies do have, thankfully, their own mechanisms for turning off a gout attack. This will occur over a series of days, up to perhaps sometimes a few weeks. However, because gout attacks are so painful and can be so burdensome for patients, we will use medicine to help treat a gout attack and get it to resolve much more rapidly. Some of the medicines that we use to address a gout attack episode include steroids like prednisone, sometimes colchicine, and even occasionally prescription strength NSAIDs such as ibuprofen and naproxen. The main treatment of gout, however, again gets back to uric acid. If the problem in gout is having too much uric acid in the blood, then the treatment is rather simple. We need to use medication to lower the uric acid to get it back into a normal range. The usual medicine that we use to accomplish this is known as allopurinol. This is a medicine that has been out for many decades, is very well tolerated by patients, and thankfully is very effective at lowering uric acid levels back into their normal range. Some patients may require additional therapies beyond allopurinol to help lower their uric acid. These can include things such as Uloric, probenecid, and even a medicine called Krystexxa. These medicines in their totality are all very effective at lowering uric acid levels. While we are lowering uric acid levels, however, patients temporarily may be at an increased risk of experiencing gout flare episodes as we move the excessive uric acid out of their joints and back into their bloodstream. To help prevent patients from experiencing gout attacks while we lower their uric acid, we will often prescribe patients a daily supply of colchicine, which acts in essence like a shield to help prevent gout attacks from happening while we lower the uric acid back into a normal range. Colchicine is always used as a temporary medicine. We will stop colchicine usually once a gout patient has been free of a gout flare episode for 6 months, and their uric acid also has been back within a normal range for 6 months as well. Once those two objectives have been reached, patients are at a very low risk of having any future gout flare episode beyond that, so long as they continue to take allopurinol or the other medicines that we may use to keep their uric acid in a normal range. Under normal circumstances, and in the vast majority of cases, patients who follow this treatment regimen are able to get incredible control of their gout, going back to living their lives without having any further gout flare episodes. Again, this is a condition that we're very adept at treating here at Rheumatology Associates, and we would be happy to help better control your gout if it continues to be a problem. Thanks for listening, and have a great day.